Orleans Humanist Perspective, presented by the New Orleans Secular Humanist Association, following are a few principles of humanism.
We're committed to the use of science and reason for understanding the universe and for solving human problems. We're skeptical of untested claims of knowledge, but we're open to new ideas.
We are concerned with securing justice and fairness in society and in ending intolerance and discrimination. We are committed to the total separation of religion and government.
We affirm humanism as a realistic alternative to the theologies of despair and the ideologies of violence. We reject the concept of an afterlife and believe in living a full and rewarding life here and now.
We value and respect each individual's right to judge and lead their lives according to their own position, as long as it's respectful of other people, living in a free society.
We hope you enjoy today's program and others in the weeks to follow. Hello, thanks again for being with us. I'm Harry Greenberger, the host of this show for all these very many years. Today we have a very interesting guest with us, and I want to introduce you to Dr. Neil Baum, who is a practicing urologist here in New Orleans. He's an associate clinical professor of urology at Tulane Medical School and Louisiana State University Medical School. He's a nationally recognized speaker and author, and also a magician who performs for children from time to time. And it makes me wonder, Neil, having a medical practice in itself is a full-time job, and you're doing all of these other things, writing books, making speeches. Where does all of that energy come from?
Well, I think it's very important that you learn to prioritize your time. And when you've done that successfully, and I'm not so sure how successful I am at doing it, but I really believe that when you are able to place things in the right order, in the proper situation, and with the opportunity to delegate, you can accomplish so very, very much.
It is, however, must be very time-consuming, because your practice alone is what most people would consider full-time occupation. You still have time for home and family?
I place my family first, and then I place my occupation, and then when time is left over, I dedicate them to some of these other areas of interest. And I find there's always enough time if you're motivated and you have an interest and you are able to delegate a lot of other activities to other people. You can accomplish so very, very much.
Well, you may have noticed in the introduction to our show that as secular humanists, we feel that since there's not going to be another afterlife, that this life should be led as fully and rewardingly as possible. Obviously, you are doing that.
I hope so. Now, I really like to feel that I'm making a contribution. I'm changing the lives of people I interact with. Yes. And when all is said and done, I go home at night and I sleep very, very easily.
That's wonderful. Now, as I mentioned, you are an author, and I read here that you've authored 5 books and co-authored 6 other books. Tell us, before we talk about your current book, which is just recently published, tell us about some of the books that you have previously authored.
Well, the one book that I've previously authored that's now in its 4th edition is called How to Have a Medical Practice That is Ethical, Effective, and Productive. And the concept is teaching physicians how to be kinder and gentler to their patients, and yet be able to see them efficiently and also be able to place patient satisfaction as number 1 at the top of the list. What can you do to make sure that every patient has a positive experience in the practice? And that's the goal of that book.
Well, aside from that being in your book, it has been obvious to me by visiting your office that you practice that. And then you have a sign on the wall that says something, we'll give you a hug. What does that sign say?
Oh, the sign says, as patients walk in or they walk out, it says, if you're feeling less than a B+, let us know and we'll give you a hug. Okay. And I have a nice little story to tell about that sign. There once was a patient that had significant back injury, and he was despondent and very discouraged because of the pain and all the pills and antidepressants he was on. He says, I'm feeling less than a B+. So I gathered my staff around. I said, Mr. So-and-so is feeling less than a B+. 4 or 5 of us came up and gave him a hug.
Uh-huh.
And, he laughed and appreciated this. And he wrote us a letter afterwards, and he says, Dr. Baum, I'm seeing a psychiatrist, I'm on antidepressants, I am feeling so despondent. I was even thinking of ending my life. And he says, but those hugs that I got that day was more important to me than all the medications and all the visits to the psychiatrist. It changed my life and turned it around, and I'm looking forward to getting well. I have to tell you, that is one of my highlights of medical practice as a result of that sign.
And I'm sure you related that to the people on your staff who gave him those hugs.
Oh, yes. We have a staff meeting, and we go around at the staff meeting and tell, what's the best thing that happened to you in this practice? And everyone said that the day the man stepped up and said, I'm feeling less than a B+, and we gave him a hug, was high on the list of everyone as the best thing that happened to them in our practice.
Okay, now that was one of your prior books. What are the titles of some of your other books before the one we're going to talk about today?
Oh, and then I wrote another book about my experience with Katrina.
Oh.
After Katrina, I came back here, and things were really a little bit slow. Not a little bit slow, they were a lot slow. I can remember days where I would see more pharmaceutical representatives than patients. And it was very, very difficult jump-starting the practice again.
Because the people were not back in the city.
Mostly the people here were workers helping to rebuild our city. So there were very few patients. There were very few physicians that returned. Younger physicians who had children stayed in other cities to put their children in school. So it was a very, very difficult time. And I was feeling kind of badly for myself, and I'll never forget my wife saying to me, come on, Neil, you write about this, you talk about this, why don't you write about your experience with Katrina? So my book was called How to Disaster-Proof Your Healthcare Practice. And it was lessons I had learned, what I did right and what I did wrong, and what advice I had to other people. And it wasn't just hurricanes that I was talking about. I was talking about fire. I was talking about electronic disasters. If your computer goes out in a medical practice today, that can be a disaster.
Absolutely.
So I wrote that book that got me stop feeling sorry for myself and getting me productive, and it sold very, very well, particularly after Katrina.
Well, and obviously you enjoy the process of writing. Does it just flow freely, or do you struggle to write?
It gets easier the more, like anything else, it's like a muscle. You have to exercise it, and when you start to exercise it, you find that it is much, much easier as you continue to do it.
Now, I'm now going to ask you about your newly published book with a very provocative title. What is the title of your new book?
Title of my new book is called What's Going On Down There?
If you let the people you hold so they can see it, okay.
What's Going On Down There? The Complete Guide to Women's Pelvic Health.
I see. Complete. You didn't leave anything out.
Well, yes, it is related to problems of mostly middle-aged women. And it doesn't cover infertility, it doesn't cover breast disease, and it doesn't cover sexually transmitted disease. It covers topics like urinary incontinence when it gets wet down there. It covers pelvic pain. It covers menopause. It covers the decision to have a hysterectomy. It covers problems of sexual dysfunction problems. Women have as many problems with sexual intimacy as men do. And so consequently, we tried to cover everything that a middle-aged woman, we picked the ages would be appropriate for women between the ages of 25 and 65, who I think would get the most benefit out of reading this book.
Well, when you say that women have as many problems as men, but I think men complain more about theirs. Is that not the case?
No, not
it's
not
not
at
the
all.
case.
Men are very embarrassed and make jokes about their sexual problems, and they suffer in silence. A great quote by Tolstoy said, "Men suffer the tragedies of the soul, but the most tormenting tragedy of all times is the tragedy of the bedroom." Men tend to go to bed later than women. They are in denial, and they often are uncomfortable discussing it with their spouse or partner or best friend, and so they suffer in silence. Women tend, on the other hand, to discuss it more, especially with their friends if they're having
with
problems.
their other women friends.
And they need to find the right doctor who is comfortable, him or herself, with their own sexuality to be able to help them solve their problems.
You're suggesting that you are comfortable with your own.
Yes, I am.
Well, I didn't want to I didn't want to be too personal.
No, you can probe. I have a very nice loving relationship with my wife of 34 years.
That's wonderful. Now, you did mention incontinence. What does a woman do about that?
Okay, let me define that so our listeners and viewers might know what incontinence is. Incontinence is the involuntary loss of urine when a woman wishes not to lose her urine. The bladder's purpose is to store and expel urine, which is the liquid waste product created by the kidneys, and it's stored in the bladder. When there's a problem with the bladder or the muscles that hold the urine in place that are weakened by childbirth, by estrogen deficiency, by having excessive weight, by previous surgery, by radiation, women have a problem of incontinence. It affects over 15 million women in the United States, and thousands of women in this community have a problem of urinary incontinence, and they have to wear diapers and panty liners, and there's nothing more discouraging to a woman to go to a store, the grocery store or the pharmacy, and to have to walk out with a package of Depends, and someone says to the woman, "Oh, are those for your new grandchild?" And the woman has to say, "No, those are for me." She
should say, "Mind your own business."
Perhaps.
Well, along that line, fairly recently, I was standing at a urinal at the casino, and a man standing next to me said, why is it that when we get older, we have to keep running to the bathroom?" I said to him, "It's a curse."
Well, we weren't probably programmed to live as long as we do.
Yes.
Ancient man probably only lived to 35 to 40.
Yes.
But after the age of 50, the man's prostate, for reasons not entirely known, begins to grow. When the prostate grows, it squeezes the tube that allows the transport of urine. So consequently, when a man steps up to the urinal and he's our age, we may have to wait a little longer to go to the restroom. We may dribble when we are done. We may get up at night to urinate. The urine stream isn't as strong as a young boy's, and it doesn't come out with the same power and force that it did. I'm from the north. And we used to, as a medical student, I was trained in the north. And when we used to ask patients, I'd say, "Are you able to write your name in the snow?" And I'll never forget a middle-aged man says, "No, I can't write my name in the snow." He says, "But I can dot the I."
All right. Well, we're getting into some pretty sensitive subjects, but tell me about, and I don't know what else is in your book here, but you have suggested that something, testosterone for women. What is that?
Well, testosterone is a hormone that is most commonly associated with men.
With men, that's why I asked the question.
And that's what's responsible for our muscles and our bone strength, and it's also responsible for our sex drive and our erections in men.
In men, yes.
Women also make testosterone, and it's small amounts. The main hormone in a woman is estrogen.
Yes.
And men make small amounts of estrogen, but women make small amounts of testosterone. And usually around the age of menopause in a woman in her 50s, the testosterone level starts to subside. As the testosterone level gets lower, their libido, their sex drive, their vaginal lubrication, all of that diminishes. And this can be helped with testosterone, either a gel that is applied to the skin every day, or now we are doing it, we put a small pellet of testosterone. It's about the size of a grain of rice underneath the skin, and in a woman it lasts 4 to 6 months. And women will often come back and they say, Dr. Baum, I feel like a light switch has been turned on in my sexual life.
And she says, put another one of those things under my skin.
And 4 months later, you can bet she comes back and asks for another one of those pellets.
All right. Now,
so it's very effective, and a lot of women aren't aware of this, and most physicians are a little uncomfortable giving testosterone to women. But if a woman doesn't have breast cancer, she is and has low testosterone and has symptoms of decreased libido or sex drive, testosterone is a miracle for these women.
But now that is little known, I'm sure, which leads me to ask, what sort of people are buying and reading this book so they find out these things that we're talking about?
Well, the book only came out in December. So it's brand new.
Who is your anticipated readership?
Women between the ages of 25 and 65. We think that women, every woman between the ages of 25 and 65 will find some topic in this book that is pertinent and relevant to their pelvic health. And the idea is that we want women to become more knowledgeable, more educated, and that they should be able to go to their doctor with this kind of information so they can have a good discussion with their doctor about the options and alternatives.
So they could talk to the doctor if they've read the book, even if the doctor hasn't read your book.
Exactly. They go to the doctor, and the doctor now knows I'm dealing with an educated and knowledgeable woman, and I just can't pat her on the back and say, take these pills and I'll see you in a few months.
And so then the patient will say, I first became aware of this from from Neil's book, and then the doctor will say, well, I ought to get that book, right?
I hope the doctor says, not only should I get the book, but I'm going to recommend it to all my patients.
Now, as you say, it has just come on the market.
Yes.
I presume, is it available where, in bookstores? Or where?
No,
where
it's
is
available on Amazon.com, and if they were to type my name in, Neil Baum, B-A-U-M, or what's going on down there,
Yes.
they would be able to get access
Okay,
to the
so
book.
that's where it's available. Well, I wish you success with the book. Now, what other topics are covered in that book?
Other topics include what to do before and after surgery, how to prepare for surgery. What do you need to do to mentally get ready for your day in the hospital? What do you bring to the hospital? What should you not bring to the hospital? How do you need to get transportation to the hospital? Do you need to have help at home, depending on this kind of surgery that you have? What kind of tubes may be inserted at the time of surgery? What you may go home with? And it answers all of these questions, and it gives a very nice checklist of what they should be preparing to do for surgery, and also what they should do after surgery. One of the biggest problems that people have after surgery is constipation. And very few doctors will discuss this beforehand with the patient. They are taking often pain medication, and the pain medication seems to prevent the colon from squeezing and expelling the material. Consequently, it is important that women know that they should take stool softeners after surgery if they're taking pain medicine, so avoiding the complication of constipation. So we cover useful, helpful tips that they can use. We have another whole chapter on stress reduction. What can people do to kind of lessen the stress that's in their lives? All of us are surrounded by stress.
Yes, without reading your book, I'd like some information about reducing stress.
It is very, I can't tell you it's easy to do, but if you recognize what are the stressors in your life, what's causing you anxiety, what's causing you to not be able to get to sleep at night, what's causing you conflict, with other people, if you can find what triggers the stress and find ways to reduce it successfully, the best way of all is exercise. Exercise. I'm not talking about swimming, aerobic, spinning class. I'm talking going for a walk. Going for a walk can elevate something in the body called endorphin. Endorphins are the most powerful painkillers available, 10 times more powerful than morphine. And you can elevate the endorphins and make you feel better just by going for a walk. So I'm not necessarily suggesting that people, join a health club. I think that's great if they do. I think that's wonderful if you do that on a regular basis. But regular daily exercise. I have noticed when I see a octogenarian or nonagenarian in my practice, I always ask them, what are you doing? And there's 3 things that they are doing that they will tell you, all of them. 1, they're exercising every day, some form, even if it's walking. 2, they are getting mentally stimulated in some fashion, usually by interacting with other people. And 3rd is nutrition. They are paying attention to what they eat.
You're saying that is what contributes to a longer life? Is that what you're saying?
I think a longer, healthier life. A lot of people are living longer lives, but they're demented, they are infirm, they are not capable of interacting the way that they would like. I think longer, healthier lives is the goal that we should be striving for. Yeah, we'd like to all live longer if we're healthy. And the way for health is, I laid those out to you.
I think getting into old age and being seriously infirm, and the worst of all would be Alzheimer's, that's not a life worth living.
I agree. So the way to do that is to think about it before you reach that point where you have those problems and start exercising, start interacting with others,
Yes.
challenging yourself, getting mentally stimulated.
I don't know how you as a physician feel about it, but I have been supportive of the Death with Dignity organizations, and I think if you have reached a point where your life is no longer worth living, that the one right that we should have is the right to decide when we're ready to go. What is your view of that?
Well, my training tells me, that you are to do whatever you can to prolong life. That's my training. But what do I really think? I really think that we as a physician should do nothing to prolong the life of someone who wishes not to go any longer. I, myself personally, would be uncomfortable hastening that demise. I wouldn't be comfortable doing that. And you have to understand, I've been a physician since 1968, so I'm brainwashed a lot about not doing that. And so consequently, I feel that I would like to help people die with dignity and die on their own conditions, but I won't do anything to hasten it, but I will do nothing whatsoever to prolong it 1 second beyond which they would like to live.
I understand. There are a couple of states in this country which allow legal physician-assisted dying under certain circumstances, this may be developing in other states as well. We've got a minute or so left, Neil. If anything you want to say to our audience about your book or anything else,
This is my chance.
This is your chance.
Okay. What I really hope is that people will think about health as not a right, but something you earn. And the way that you earn it is to be knowledgeable about what's going on in your body. Don't take your health for granted. Do things every day that make you a healthier and happier person.
Well, that sounds like excellent advice. And I just want to say to you folks who are watching our show, I hope you have found this program interesting and enlightening, and you know where to get the book if you want to do so. And Neil, it's been a pleasure seeing you here again, because we've seen each other through the years. And let's just hope that for both of us, the year 2013 will be a good year.
Thank you. Thank you so much for having me, and I hope to come back again soon.
Okay. Thanks, Dr. Baum, and thank you, folks.